Hi, today we welcome Samantha Crompton. Samantha is a midwife and an SCLC lactation specialist with many years of experience working with moms and babies. And we felt that it was pretty important, given the current environment, given I think how frightening it might be for some moms who are pregnant at the moment, giving birth at the moment. We wanted to talk about what it may be like to be giving birth in hospital, breastfeeding, all those kinds of things. Samantha, welcome.
Thanks so much. It's so lovely to be here and giving our moms as much support as we can in any medium.
Absolutely. Any way we can. Yeah. Absolutely.
Any way we can.
So Samantha, and we were talking before and you were saying that at the moment you aren't able to do the work that you normally do in some of the hospitals. So I guess I just wanted to give some thought to what the experiences of moms now, giving birth, going into hospital, given that they don't have access to some of the normal lactation specialists and consultants that they normally would do. Maybe you can just share with us a little bit about the experience of moms and what are some of the things that they can hold in mind and think about as they're kind of going into hospital and having their babies.
Yeah, to be honest, I'm glad I'm not pregnant at the moment because I'm seeing so much stress happening in our pregnant parents. And it's a lot about sort of the unknown and the change of their birth plan. And, I had a lot of moms who had sort of pre-planned to see me. They already had booked me for when they were more or less in hospital. And that all just blew up because we couldn't be there. So there was that initial anxiety. And there was a lot of stress around what certain hospitals allow and what they don't, and I think that uncertainty is also really hard for moms, but or parents. And what they're experiencing is that there is that little bit of lack of support from their own people, as in sometimes their partners aren't allowed to stay with them, or their toddlers aren't allowed to come and meet their baby in hospital, as well as they can't have their mom and dad come see the baby. And there's a lot of that initial support that's not there, and then as well as the professional support isn't there. So like they can't have the person they knew, the lactation consultant they chose, coming into the hospital. But I don't think all is lost. So what we try and ask the parents to do is be proactive in this. So I've always advocated for prenatal lactation consults, because I think when you're getting information, when you're still we're not in that anxiety, have to feed my baby now brain, you can absorb a little bit more information. So we chat about maybe doing a prenatal lactation consult with someone, whether it's in person in a home visit setting or whether it's over a telehealth setting, just so you're going in armed. I think that's with a whole lot of tools in your toolbox, that's what we're looking for. And then you've got that connection. And I've had a few moms who are doing a telehealth consult with me in the hospital, because I don't have to physically be there. Obviously, that's the prize. We want to physically be there and helping you hands-on. But if we can't be, we offer as much support as we can. And then if the mom's still really battling, we are able to do home visits with all our protocols in place and things. So there is hope out there. And there's lots of people who can help you in various ways. We're just becoming creative. I think that's what we're doing at the moment. So there is stuff you can do, but I want you to be pre-armed. I think that's the important part.
Yeah, and I think what you're saying is so important. There's so much uncertainty. There's so much that's not known. I mean, mothers who give birth generally have some sense. You go and visit the hospital beforehand. You know where you're going. You know your doctor. So at the moment, there's so much uncertainty. But what you're saying is take back some power where you can. Go in armed with information, particularly because your lactation consultant can't come visit you in hospital, and then, as you say, once you have a relationship, it might be easier from there, and you've got your baby, to kind of negotiate some of the challenges often with breastfeeding that moms face in hospital.
Yeah, and I mean, often it's just a case of you need someone to just say to you, yes, you're amazing, you're doing well. It sounds silly, but that's a large part of my job, is that affirmation.
Absolutely.
Yeah. That affirmation saying, well done, you did an amazing job and you're continuing to do an amazing job. Here's 2 extra tools you can try, just to make it that little bit more along what you want. And that's all it really takes, to be honest.
And that's part of why it's so important to choose your people, because I mean, we were having a little bit of a discussion earlier, and I know that a lot of the mothers that I work with, have had comments that have been so destructive. You know, people sometimes make throwaway comments or say things that are maybe not so supportive or a little bit kind of critical, and it can be so damaging. So if you surround yourself with the right supportive people, I think it also just makes it that much easier.
I mean, it's so important. We chat about in our SCL group about surrounding yourself with cheerleaders. And I think that's that is so important. And by cheerleaders, we mean people with the same mindset as you, people who understand your goals. And your friend's goal might not be the same as your goal, and that's okay. You know, there's nothing wrong with that. But when you're supporting a person, it's not about saying this is what you must do and this is what has to happen and this is all. So that's not supportive necessarily, and we're not always coming from a bad place. So sometimes we're trying to be really helpful and we're saying, well, I did this and that worked really well for me. And the problem is that when mom's in that vulnerable place, they often hear, well, then I'm a bad mom. I'm not doing it right. I can't, I'm clearly bad. And that's what snowballs into real big problems. And I love listening. I love teaching people about how important words are and just saying these words are so important and we've got to understand the mom before we offer any words of wisdom, if I could put it that way.
No, absolutely. And I think breastfeeding actually is a minefield. It can be. I think society has this idea that it's just natural and mothers just breastfeed. And if you're maternal, then it just happens. And I think for many moms, it's very hard and it's challenging, especially, you know, at the beginning as you're starting. And I guess I wondered, what advice do you give for moms who are ambivalent about, do they want to breastfeed, should they breastfeed, feel like they're failing at breastfeeding? What advice would you give?
So usually I take the moms back and I explain to them that breastfeeding isn't something that just comes naturally. I always explain, remember we used to, when we started out, we were brought up in a village, okay? And we never were left on our own. So we had the village elders who came in and taught the mom how to breastfeed. So breastfeeding is a taught practice. It's not something that just happens. And I think if we start to understand that, So I start with the thing saying, you're not going to go run comrades if you've never ever put on tackies and run before. So what makes you think you can just suddenly know how to breastfeed? You have to have had some input in there. There are the odd moms who literally, baby comes out, they pop them on the boob and they just breastfeed, and well done. That's wonderful. I wasn't one of those, and I can tell you, obviously I'm seeing a skewed view, but all the moms I see, not many of them are those. It's actually something that we've learned and we practice. It takes a good 6 to 8 weeks to get breastfeeding right. And I think if moms are hearing that more, that no one expects that baby to pop out and you just click and you know how to do this. It takes practice and it takes time. Where the anxiety comes in is now you've got responsibility of feeding this child. And I think that's where we start to panic a little bit, which is why I like the understanding, the prenatal side of things, so that you're in a happier place, you know what you're doing, we've discussed what your goals are, and your goals can change. I've had moms who, this is their goal in prenatal, that baby comes out and their goals are completely different, and that's okay. It's a flexible thing. It's not something that I've decided, beforehand. I decided I was going to do this and now I'm hating it and I'm feeling too guilty to change. That's not supportive. Supportive is around you. This is hard, but things that are hard, things that are good for you generally are hard. I'm always tell my mom, lying on the couch, watching Netflix, ordering Uber Eats, that's easy. What's hard is going to the gym and running and all of those things. That's hard.
Yeah.
That's hard. And breastfeeding is hard. It takes work, it takes motivation, it takes support, and it takes practice. And I think that's the important thing. It does take time to get right. And there's no shame in asking for help. You need help. All of us need help. We have a number of lactation consultants on our group, and the minute they start breastfeeding, they're phoning us saying, please come see me, I need help. and that's okay. No one's an expert in this at all.
Right, absolutely. And I suppose, you know, there's so much in society, and we know the benefits for baby. We know there's so many amazing benefits for breastfeeding. But of course, there are those moms that just don't want to, that for whatever reason, for what personal reasons or kind of historical reasons, find it a bit abhorrent. They don't want a baby on their boob. They don't. And I mean, I know certainly that often the kind of societal pressure around you have to breastfeed or it means you're not a good mom can actually, you know, set moms up for a postnatal depression or a kind of really challenging time. What would you say to moms who just don't want to do it?
You know, the number one thing is it's okay. You know, it really is okay. There's no, life is about choice. And all we really like to discuss with people is, where's this coming from? Because I don't like people to make decisions based on fear. Okay, so that's really not a good thing. So we often, if we just discuss what it means, what's happening, all of that, then the moms relax. We don't want it based just purely on lack of support, because that's where a lot of moms are coming from, is they've had no support for 4 weeks, and then they just go, I hate it, I can't do it, it's so. And so it's not necessarily what they wanted, but it's because of where they've ended up and they're hating it. And that's okay. And then there's some moms who just hate it from the beginning. And then we chat around goal setting. So we say, well, what's important to you? Is it the physical breastfeeding that's important to you? Is it the breast milk that's important to you? You know, is it the holding the baby that's important to you? The skin? What area is important to you and what area is really stressing you out? And then we unravel it from there. And we've got to remember there's a lot of moms who have suffered abuse in the past. So we can't just jump on them and say, you have to breastfeed, because we see so many of these memories coming up when they start to breastfeed and things. So to just say to a mom, you have to breastfeed because it's the right thing to do, without having any knowledge of her life or anything like that, is actually not a good place to be. We really investigate, and this is where I think choosing your support person is very important. And I've had moms who only sort of 4 months down the line are they starting to open up as to why they didn't actually want to breastfeed when they're in a support group setting. And then you sort of go, now everything makes sense. But if she had been told, as you said, if she had been told, you have to, you do this, she's just going to think she's a bad mom, and that was not the reason. She's not a bad mom. No one's a bad mom.
Right, absolutely. So I guess, I mean, some of the key things that it really sounds like have come out of this discussion are, firstly, that you have control in choosing the people you want to support you. And I often say to moms, actually go and interview people, go and interview nurses, go and interview doulas. You know, I mean, doulas are a bit challenging at the moment, but in general, the people you want to surround yourself, make sure that you have a connection, you know, their philosophy fits with yours, and that they're going to support you.
Yes, I encourage the interview. I say to people all the time, go question your doctor, go question your lactation consultant. I've had people who phone me and they have one sort of interaction with me and they're like, you're not my vibe. And that's perfect. You know, that's absolutely perfect. And then I pick up on where they are and they say, you know what, I think you gel better with this person. And we refer on to that person because we know that that's more along their personality, and that's okay. You know, you don't want to be stuck with someone just because you feel bad with them, that you don't want to leave them. You know, like, move on. You know, if you're not enjoying it, get a second opinion, move on, try someone different. It's
right. Because mothering is hard, you know, so I suppose, you know, for mothers to feel like at a time when so much is unknown, that you can still make concrete decisions and you can be honest with yourself about what you want and what you need. Because we know that actually the most important thing is that you have a relationship with your baby. That in some ways is more important than anything else.
No, absolutely. And this is where I'm teaching the moms, and I'm saying to them, look at your baby, watch your baby, look at your baby's needs. What are you and your baby's needs at this time? Bring in their partner. What do the three of you need? And then we figure out plans based on what is best for that whole family. And that can be so many variations. It can be variations of, you know, breastfeed here, pump there, formula there. You know, there's so many variations, and it's about what will make you and your baby bond the best and be the happiest. And that's part of a little bit why I'm loving lockdown, because the moms have time to, or moms, parents, I keep saying moms, I shouldn't, parents have time actually sit with their babies and watch their babies and look at them and really get to know them and understand them. And that is the most important part of anything. It's the relationship and making it happy for everyone. And we sometimes forget the partner in this as well. They're the most important support person. So they have to really be brought into this as well, to say, are they happy? Are they understanding? Do they want this as well? Because without that support, it's all going to collapse.
Yeah, absolutely. Samantha, I think that's such invaluable information. Thank you so much for coming onto this podcast.